Hello and welcome to PEMCO TV, keeping you up to date with key insights from leading industry professionals within the world of commercial property management. I'm Melissa Kent. Today we are joined by our very own Managing Director Keith West. And today we will be discussing the view that health and safety compliance within the property management sector is about to get a whole lot simpler. Hello Keith, welcome. Thank you for joining us today.
Hello Melissa, good to be here.
Firstly Keith, I'd like to ask how you think health and safety compliance is viewed by people in the property management sector.
Well, I think health and safety is viewed as something that you have to do. And that brings with it a whole load of negative connotations. It's very much viewed as a grudge purchase by those that are buying in health and safety services from outside suppliers. But I don't think it has to be that way. In fact, I've never viewed health and safety compliance as being that way. And last year was a year of real change within health and safety. I've always viewed health and safety as being something positive, something that can differentiate you and your business from your competitors, and that really excites me.
But not everybody sees it that way, so what makes you so positive?
Well, I think you're right. I think most people don't see it in the way that I see it, but I also think that the health and safety industry itself and those involved in it haven't really helped the situation. I mean, the typical view of a health and safety professional or health and safety inspector is someone walking around your premises with a clipboard in hand, asking you lots of questions and trying to find out all the things that you need to do and that you perhaps you haven't done. So it's a very negative connotation. And generally the recommendations either cost you a lot of money or they involve you changing the way you run your business, neither of which are particularly agreeable to most business owners. So I don't think the industry has particularly helped itself, and I find that quite a frustrating situation. I'm part of that profession. The media, and especially the press media, have been quick to latch on to stories that are at best misleading and sometimes downright untrue. And I've always found that very frustrating, that the health and safety profession is stereotyped in that way. But it's not just me that experiences those frustrations. The health and safety executive as well get very frustrated about the media portraying our profession in a negative light. And the health and safety executive in the UK have gone to great lengths over the last 3 or 4 years in trying to dispel some of those myths, as they call them. And they launched a fabulous service on their website called the Myth of the Month, where each month they tackled a common myth that was perpetrated, usually by the press, and set the record straight. For example, we were told by the press over recent years that the activity like cheese rolling at village fetes was banned, like the use of playing conkers but in school playgrounds was banned. We were told that knitting in hospitals was banned, and even toothpicks at one stage were banned. In reality, none of these things have been banned by the HSE. What's happened is that they've been stopped by overzealous officials worried about being sued in the civil courts and insurance companies trying to limit their claims payouts. To my knowledge, the only thing that I can remember the health and safety executive actually banning is the use of asbestos, and quite rightly so in my view, as that today still kills about 4,000 people every year. To my mind, far too often health and safety has been used as a useful excuse for an organisation or a business not to do something. And I share the HSE's view that it's now time to challenge that situation and to focus on real risks, the things that really hurt people in their working lives, and to not get over excited about trivial risks that can easily be controlled by simple management regimes.
Do you think that we've been overly cautious in managing risk in the property management sector in recent years then?
I don't think you can be too cautious in managing risk. Managing risk is a serious business. But I do think we've overinterpreted several pieces of legislation that are relevant to the property management sector. To my mind, the most useful piece of legislation is the Health and Safety at Work Act. And we brought that into force way back in 1974. I think it was a brilliant piece of lawmaking because it introduced the concept of risk, and it introduced terms like reasonable practicability and reasonable foreseeability, which are the bedrock of today's modern risk assessment methodologies, although we didn't call it risk assessment back in 1974. To give you a couple of examples in the way that I believe that we've overinterpreted legislative requirements in our property sector, first of all, portable appliance testing. Most people that I know believe that you need to test your portable appliances on a 12-monthly basis. In fact, if you look at the legislation, there is no frequency mentioned. It's based on risk. Some you need to test more frequently, and some you can do less frequently. So I think that's one example. Another example is COSH risk assessment, where a lot of people I know and a lot of consultants I know would recommend that someone who's running a low-risk environment like an office would do a COSH assessment on correction fluid or correction pen, which is used in minute quantities and is, to my mind, a very trivial risk. If you're managing a low-risk or low-hazard environment at your workplace, the law doesn't require you to employ the services of a health and safety consultant, although a lot of people do. My view is that most business owners are quite capable of managing health and safety risks within such environments, particularly if they're given a little bit of guidance. In fact, my own view is that as the boss of an organisation or a department, if you're seen to be engaged in health and safety and you seem to be believing it yourself rather than calling someone outside, you're far more likely to have a positive effect on the health and safety culture of your own organisation than any external health and safety consultant could possibly achieve in their lifetime. There's a simple reason for that. If it's important to the boss, then it gets done.
Earlier you said that last year was a real year of change in health and safety. Can you tell us a little about that?
Yes, I can. 2010 was a significant year of change, partly brought about by the change in government, the new coalition government that was elected last year, partly due to the economic situation, the downturn in economics and the desire to reduce the costs, particularly costs of regulation. And generally the public view that legislation, particularly health and safety legislation, has got a little bit overly bureaucratic and rather burdensome for some industries to bear. On top of that, our Prime Minister David Cameron asked Lord Young to produce a report on health and safety to see what changes could sensibly be made. Lord Young did this, and it was published in October 2010, so not very long ago, and it was entitled Common Sense, Common Safety. So that gives you a theme of what it was about. I can take you through some of the salient points of that very quickly. A large part of Lord Young's report deals with our compensation culture, and Lord Young has recommended that we simplify the whole process of compensation claims management and deal with it in a very similar way to we currently deal with motor claims. So any claim under £10,000 is dealt with very simplistically on a fixed cost basis. Secondly, Lord Young's report looked at what he calls low hazard workplaces like shops, offices, school classrooms, for example. So we're not talking about nuclear power stations or industrial processing plants, chemical factories here, very low risk workplaces. And his view, quite sensibly I think, is that we simplify health and safety legislation that's applicable to those particular working environments. And in fact the Health and Safety Executive just earlier this year, in response to that, launched an online risk assessment system that can be taken on the health and safety website for such low risk environments, and it really has simplified the whole way that we manage risks in those type of working places. The next recommendation to come out of Common Sense, Common Safety is the recommendation that we professionalise the health and safety industry, particularly the consultants that work within that industry. The recommendation was that we have a national register of health and safety consultants. I'm pleased to say that register is now in place. It's been in place since the beginning of 2011. It's called OSCA, the Occupational Safety and Health Consultants Register, and there are set criteria, reasonably strict criteria for a consultant to be included upon that register. This is a place where the public can go and have some reassurance if they're choosing a consultant from the OSCA register that they're getting a consultant that's actually competent and can do the job they're asking them to do. Next, there are some recommendations for the insurance sector, where the report recommends that for those people that are operating in the low hazard workplaces, as I mentioned earlier, like shops and offices, that the insurance companies cease to require such businesses to employ the services of a professional health and safety consultant in order to undertake full risk assessments. That, I believe, is a very welcome recommendation. And it goes on to say if an organisation does employ the services of a health and safety consultant, then that health and safety consultant should be listed on the government's OSCA register that I've just mentioned. And finally, the report recommends that the Health and Safety Executive should produce some guidance, sort of a code of practice for small and medium-sized businesses with a view to helping consolidate the large number of separate pieces of health and safety legislation that are applicable to such organisations. So in conclusion, Melissa, I'd say that the future of health and safety enforcement is moving towards simplification with an emphasis on proportionate enforcement. These changes reflect public attitudes towards risk versus regulation, but they're also a product of the current economic climate demanding the more cost-effective regulation. So yes, I do believe that all in all, these proposals should make compliance within the property sector a lot simpler.
Okay, thank you very much for your time, Keith. It's been good to chat to you today. Well, thank you for joining us, and we'll see you next time on PEMCO TV.